Alright, so the first one that I'm going to work on is gastroesophageal reflux disease, or GERD. GERD! Alright, signs and symptoms. We have dyspepsia, which is heartburn, and reflux. I wrote down here that the condition is aggravated when laying down, usually aggravated when laying down, because, think when you're laying down, everything just comes up easier. So one of the interventions that patient teachings that I'm going to talk about later is wait 2 to 3 hours before laying down, which after eating. Alright, so some other signs and symptoms is coughing, chest pain, dysphagia, belching, flatulence, and bloating. Then a way of diagnosing GERD is by EGD. I think it's esophageal, gastric, I don't know, something. I'll have to look that up in a minute. Or by barium esophagram. If you think of that, just think of, esophagus. It's just easy way. Nursing interventions is diet therapy, lifestyle changes, drug therapy, and general education about GERD. Because if you don't know what you're doing, you're not going to know how to fix it. Okay. And then patient teaching. Avoid foods high in foods that increase gastric acids, which is like a lot of the, we'll just get there later. Avoid foods that are high in fat or spicy, because that can make the heartburn a lot worse. Think of how spicy it is going down, and if it has to come back up, and it's and garlic was put in there too. And instead of eating a large meal and just stuffing yourself full, eat 4 to 6 small meals. Avoid carbonated drinks because of the bubbles, making your tummy hurt more. Don't drink so much caffeine. Caffeine, alcohol, and cigarette smoking is like the worst thing that you can do in the entire world. And a lot of the diseases will show that. This one sucks. Get rid of chocolate. Peppermint and spearmint. Most of these, they do something with either relaxing the sphincters so that everything can come back up, or they increase the stimulation of gastric acids. So that. And then another thing that the patient can change is get their weight down. A lot of research shows that when a patient gets their weight down by 10%, they already have a better chance of controlling the gastroesophageal reflux disease. And then something that they can do immediately is raise the head of the bed up 4 to 6 inches, which if you think laying down, everything's flat, it has easier flow to go up into the nice tasting heartburn. Wear loose clothes. Who wouldn't want to be comfy? And take all the meds as directed. And that is GERD.